that information is not protected in the same way as that same bit of information if it is given to a psychiatrist. It's not the information so much that's protected, it's where the information is given. Mental health providers have that extra layer of protection on their records that other providers do not have necessarily.
For some, keeping their mental health prescriptions private is important.
Information on a prescription history is very informative. It might not have treatment information at all, but just what you've taken tells a lot about what you've had wrong with you.
On the other hand, prescription information is precisely the type of knowledge that other doctors need to know about in order to provide safe care.
You as a patient, of course, can decide what you want to share and not share with a clinician. Here's the challenge. Suppose that you come to the emergency department and you hide a mental health history. Mental health medications are the worst medications for drug-drug interactions. It's really likely that somebody's going to give you a treatment that could harm you.
Just as Massachusetts laws spell out how sensitive information can be shared between providers, there are specific laws detailing how sensitive health information flows to insurance companies.
Health insurance companies collect a lot of information from claims. When providers submit requests for payment, they have to say what's the diagnosis and what service was performed. They might know whether a patient has a mental health diagnosis, or they might know if a patient has had an AIDS test. They might not know the result, but they'll probably know whether or not the test has been administered. So in this state, in Massachusetts, they're specifically limited in what they can do with that information, and there are very detailed rules that tell them how they have to protect and control that information.
These detailed rules provide reassurance. But what protects us from those who don't follow the rules?
So often patients ask me, are my electronic records perfectly secure? And the answer I tell them is, they are as secure as technology can make them secure. But any technology with enough effort can be cracked. I am attacked on the Harvard Medical School and care group networks every 7 seconds, 24 hours a day, 7 days a week. Now, where do those attacks come from? Half come from Eastern Europe, and the other half from Eastern Cambridge, where MIT is located. I employ 4 people and spend $1 million a year protecting the security of electronic health records. So I will tell you, in the 10 years that I have been protecting health records, we have not had a breach of an electronic health record. But it is a constant Cold War.
Converting paper records to electronic format can be both helpful in terms of privacy issues. It actually can be more secure, and it can be less secure, all at the same time. A push of a button on computer records can transmit them to thousands of people, but one of the things with electronic records is you do have an audit trail of who's looking at your records. So you don't have that with paper records at all.
When thinking about privacy and security, I think it's about balance. Balancing the risks and benefits, and trust. Trusting those people who are taking care of you.
We're trying to make a complete loop, and then we'll probably do.
If your healthcare falls into specific protected categories, you have choices to make about when to consent to sharing your information.
As a psychiatrist, I still feel that the benefits of sharing personal health information in the medical record far outweigh the risks. Not only do I need to understand the patient's medical disorders and how they might interrelate, but it's important that I communicate back to that primary care doctor the medications that I'm treating the patient with, the potential for interactions, and that requires the ability to share information.
Information is really what makes the healthcare system go. The doctor knowing about your condition, the dietitian knowing whether you have a food allergy before they bring the tray up to the bedside, the pharmacist finding out what other medicines you're taking before they fill a prescription for a particular drug. All of those things require the use and disclosure of information.
Did you have a good time in Hawaii?
Actually, doctor, I didn't. That's what I wanted
shoot.
to talk to you about.
Shoot, what happened?
Our ability to provide health care depends on the patient being forthcoming about all of their concerns, their symptoms, and a proper history. If they don't trust us and our discretion about the use of the electronic medical record, they may withhold information, and that could have dire consequences for their medical care.
The best way that people can participate is by having lots of conversations, and whether it's with their friends or their physicians, they need to know what their rights are and what questions they should ask and where they can go to find out more information.
We encourage you to begin your investigation by visiting the following websites: